Helen Keller was once quoted as saying, "Blindness separates people from things. Deafness separates people from people." Hello, I'm Pamela Martin. During my 35-year career as a broadcaster, it was a privilege to bring important news events into people's homes. It was my role as a journalist to help my audience stay connected with our ever-changing world. Hearing health is a vital way to stay connected in our relationships, which improves our overall well-being. And it's for that reason that it's important to know your local hearing professionals. Today, I'm talking with Dr. Ramia Narayanan, a registered audiologist and owner-operator of the HearingLife Clinic in Squamish. So welcome, Ramia. So happy to have you here.
Thank you.
Can you tell us what it was that inspired you to work in hearing health?
To really tell you the reason why I got into the field of audiology, I need to take you back a little bit. I am from India, and generally in India we have larger families, and my brother is the eldest in the family. So as the eldest person in the family, he was responsible, and he had to make sure that everything ran really well within the circle of the family. And my cousin was born with hearing loss. My dad, being the primary caregiver, he took my cousin to speech and hearing clinics to help and figure out if there was a lot or something that can be done to help him. So that's how he got introduced to the field of speech and hearing. Again, going back to being from India, our parents have a lot of say in what we decide to do with our life. And my dad kind of like gently encouraged me to see if speech and hearing might be the field for my career. And I've never looked back since then.
Wow, so you must have been inspired then.
For sure, yes.
Yeah.
Yeah.
Well, tell us about some of the memories you have of clients who really inspired you.
There's a lot of patients who encourage me or keep me motivated to do what I do every day. There's not special instances, but as I see clients every day or patients every day, everybody has a story, and it is amazing that I can be of help for them.
Mm-hmm. Well, you know, we tend to think of hearing loss only happening to adults, older adults especially, but actually children can experience hearing loss, and you treat children in your clinic. Is that right?
Yes. So hearing loss doesn't have any age limitations like any other disorders that we deal with on an everyday basis. Thankfully, we do have a really good newborn screening, hearing screening program that tends to catch a lot of babies who are born with hearing loss, but some of them do skip the screening or kind of, fail past the screening but end up having hearing issues. So we in the clinic do testing for those children.
So what are some of the common causes of hearing loss, especially in adults?
There are a lot of causes. Some of them are environmental. Our world is becoming noisier by the day, by the minute. Working with heavy equipment can lead, without use of proper hearing protection, can cause hearing loss. There is a genetic predisposition to hearing loss as well. So as some, if there is a family history of hearing loss, there is a higher probability that you will end up having some hearing loss. And then there are some medical conditions like, a history of ear infections. There is something called sudden hearing loss, which is something that often goes unidentified sometimes because you suddenly lose your hearing and then people think, okay, it'll come back in a day or two, but the key is to have immediate medical attention. So there's a lot of causes for hearing loss in adults.
Well, people should remember that. I know my mother had that happen to her, and she did lose the hearing in one ear, but luckily she could save the hearing in the other ear. But it was important to get treatment right away. So what are some of the signs that people should look out for that, maybe someone that they know is experiencing loss of hearing?
Hearing loss is a very slowly progressing condition, which means that often people don't realize that they have a hearing loss. It's kind of like vision. You slowly start, focusing on bringing your paper closer to you, but you compensate. So we all do that to an extent. But generally, people around us tend to realize that, okay, you're bringing your book closer. Why are you doing that? It's the same with hearing. When there's a hearing loss, initially the patient or the person is able to compensate by, sitting closer to the person that they want to listen to, or making sure that the environment is quiet, and kind of compensating for the hearing loss. But the people around this person, they notice it first because they're constantly asking for repetitions, or just not hearing when they're being called, things like that. So I feel like more than the person who actually has the hearing loss is the people around them that notice it first.
Right. When someone keeps the TV turned up very, very loud, for example, I've seen that.
Yes. Yeah.
Right. So what about the use of hearing aids? I think some people may be self-conscious about getting one, but actually they're amazing, especially the new ones.
Yes. So I've been in the field for about a little over 10 years now. So I've seen how hearing aids have changed with time. Back in the day, I don't think I'm old enough to say that, but back in the day, we had really big, huge analog hearing aids, which kind of completely sat in the ear. They were big, they were bulky, they squealed all the time. But things have changed quite a bit. Hearing aids are a lot more user-friendly now. They're designed to be discreet, so people don't notice it as much. And as the newer generation, we all tend to have iPods or earpods in our ear. It's something that everybody uses. So I think we are progressing towards maybe a newer generation where we don't have to deal so much with the stigma of hearing aids.
So when a client comes in for a hearing test, what can they expect?
So generally, when I first see a patient, I start off with a detailed case history that gives me information as to what could be the problem. I need to make sure that make sure that the patient has a condition that is not medically treated. So there are some hearing losses where there could be a medical component that's contributing to the hearing loss, which can be treated medically with surgery or medications. The detailed case history lets me decide how I should proceed with the patient. The first step is to generally take a peek in the patient's ears, take a look in there, make sure that there's not too much of a wax buildup or any other abnormalities in the ear canal. And then we go ahead with the hearing test. The hearing test is where the patient listens to a few tones of different frequencies, of different loudness, and just trying to find at what level they can hear the tones. We also do a bit of speech testing where the patient listens to a few words and he or she responds back to us. So all of that gives me information as to what kind of hearing loss they have and what kind of treatment they need, or what treatment plan we need to come up with.
Mm-hmm. I have to say that I had the test myself, and I found it was really easy, it was very comfortable, and very thorough. I really think that the person testing me got to the bottom of it. Do you know what the results were of my test?
Yes, I did see your audiogram. So you do have a mild hearing loss in the higher frequencies. Very mild that it shouldn't really affect your everyday hearing or conversations. But it's always good to kind of keep track of your hearing, which is something that unfortunately doesn't get done. So the key is to make sure that you get tested every year, follow up, make sure that things are not changing with time.
Right, absolutely, very critical. So once you get the test, then what happens if you find something?
Depending on what the test result shows, if the person is ready to accept that they're ready to try hearing aids, that would be the next step. Or if the person needs more medical attention, then report is sent to the doctor, and the doctor makes a referral for the person to see the ear, nose, and throat specialist, and they will take care of the rest.
Mm-hmm. Okay, now a lot of people, or not a lot, but some people suffer from a kind of ringing in the ears. I think it's called tinnitus. Mm-hmm. And you offer therapy for that particular disorder.
Yes. Unfortunately, tinnitus is one of the most common things that we deal with. To just describe it, it's just a sound that you hear in your ears, in your head, without an external stimulus. There's a lot of conditions that can cause it, but generally, a lot of noise exposure causes it, or there could be some medical conditions that causes the ringing in the ear. I'm one of the few audiologists who is trained to provide tinnitus retraining therapy. It is a process of helping the patient or the person really deal with the tinnitus and make sure that it's not affecting their everyday life.
I mean, I know people who've had that, and it's really been a lifesaver to get that kind of therapy so that you can get past it and live a normal life.
Exactly, yeah.
Mm-hmm. Okay, well, thank you so much for sharing your knowledge with us today.
Thank you. It was a pleasure to be here.
Isn't it true that when our eyes start to fail, we get our vision tested or see a dentist to maintain our oral health? Well, sadly, many of us ignore the early signs of hearing loss. After all, our hearing is an important sense, one that can significantly impact our quality of life. So don't let hearing loss stop you from living your best life. Book a free hearing test with Dr. Ramia Narayanan and her team today and experience how their personalized care can help you keep being you. So what are you waiting for? Get to know your local hearing professional. Visit hearinglife.ca/Squamish or hearinglife.ca/Pemberton and love your ears.